Today, let's look at how to administer intramuscular injection. So these are the items you will need on a tray.
Tray for administering IM injection. Treatment sheets for a patient. Kidney dish for use swabs. Gallipot containing cotton swabs. Syringe and needle for administering medication. Methylated spirit for cleaning the site. Hand sanitizer for keeping the hands clean. Disposable gloves. IM medication. A safety box for keeping used syringe.
So from here, you go and ensure the medication order. You do that by confirming the order from the patient's folder and compare it with the one on the treatment sheet. Or you confirm from the computer and you check that the medication written on the treatment sheet is the right medication. Also use this time to check the expiry date and check the time to ensure it's actually the right time for the medication to be given. Then you go to the bedside and check that it's the right patient. That is confirmed that the name on the bedside sheet actually belongs to that patient you are going to give the medication to. So after informing patient, you go and prepare your tray and bring it to the bedside. Then you come and do confirmation again. You confirm name, medication, time and everything again. Then use the opportunity to explain procedure to the patient by informing her what to expect. I have a video on how to explain procedure to a patient. So find that and watch. After explaining procedure, you check the rights of medication again before you withdraw the medicine. So here you have to open the syringe in a sterile manner and assemble it. That is, make sure you don't contaminate the needle or the syringe. Don't touch any parts that's supposed to go into the medication or go into the patient's skin. So after assembling it neatly, you open your ampoule. You can break or file it. Usually you break away from where the dot is on the ampoule, and then you have to use a cotton, else it can cut you. And break it firmly so that you don't get pieces falling into the medication that can be injected into the patient's body and cause harm. So when you break it neatly, you always put your used items in the kidney dish you brought. Then you withdraw the medication. Drawing, you have to put needle inside the ampoule and withdraw every bit of the medication and ensure that you don't withdraw too much air. So after withdrawing, you have to expel any air that comes with it, because we don't inject air into the patient's body. Then right after that, you change the needle, which is a very necessary step because the needle you use to withdraw the medication becomes blunt, which will be very painful when you use to inject the patient. So the needle you are going to use for the injection should be a fresh needle so that patient will not feel the pain. Then position patient well to have the buttocks at the top. That is, if you are giving it at the buttocks, then you expose the buttocks and divide one of the buttocks into four parts. Then you are going to inject the upper outer quadrant of the four. So you clean the sides with the antiseptic, hold the buttocks firmly to have the muzzle pushed up, then inject deep at 90 degrees. Withdraw a bit to ensure that you are not in a vein. If there is no blood in it, then you push the medication inside. Right after pushing, you withdraw the needle fast and discard into the shots box. Then use the cotton wool to apply pressure on the site to prevent bleeding. Cover patient well. You also have to tell patient sorry when you are injecting, because no matter what, there will be some form of pain. You congratulate patient for cooperation as well. Then remove your tray, remove your screen, sanitize your hands. So that is what she's doing. You have to sanitize your hands after each patient contact, or wash your hands. The hand washing is even better. Then right after that, you document the procedure by charting that the medication has been given, and also write the nurse's note that, for instance, I am diclofenac 75 mg administered at the set time. Ongoing observations done. Patient is comfortable in bed. So always write the nurse's note in the third person. You remove your sharps box and then the procedure is done.